Hey there, welcome to part 2 of All About Plantar Warts, and in this video I'll be discussing various treatment options available, including over-the-counter remedies to in-office treatments. And we'll be exploring what works and what doesn't, and at the end of the video I'll be sharing my professional opinion and experience on these matters. So let's get started. Hi, my name is Dr. Dean Kim, and I'm your local podiatrist here in Frisco, Texas with Greater Texas Foot and Ankle Specialist, and let's dig deeper into plantar warts. When it comes to plantar warts, people often turn to home remedies and over-the-counter treatments, like you see on CVS or Walgreens. Now, these include salicylic acid, cryotherapy, and even duct tapes. And one popular method is using salicylic acid, which comes in either the liquid or patch form. Now, here's the issue with these treatments. Number one, it is not strong enough to penetrate the thick skin at the bottom of your foot and get to the root of the wart. And issue number two is that our body often reacts to acid as a threat, resulting in the formation of callus, which actually ends up protecting the wart. And this means that, again, acid never truly reaches the wart and do what it's supposed to do. And lastly, with the salicylic acid, there's no way to protect the surrounding healthy tissue while applying the acid, which damages the surrounding healthy skin, and this could potentially cause even further spread of the wart. And I've seen many patients walk in with serious wounds after using these type of products, so I do not recommend them. Another over-the-counter treatment is cryotherapy, using cold to destroy the wart. But unfortunately, these products aren't as strong as liquid nitrogens that we use in our medical office, and often don't penetrate the thick skin at the bottom of your foot, effectively treating the wart. And if you don't use it properly, again, you could damage the surrounding tissue and cause a wound or a spread of the wart. So again, I don't recommend these products. Now, one remedy you may have heard of is a duct tape. Though some swear by it, but there's no scientific evidence to support its effectiveness, and from my experience, this method just doesn't cut it. So again, don't waste your money and don't waste your time on duct tapes. Now, overall, over-the-counter products don't work as well, and oftentimes by the time my patients present to my office, they come with a larger size warts compared to where they started in the beginning. So now let's talk about in-office treatments. A common in-office treatment is cryotherapy, this time using a liquid nitrogen to freeze the wart. It is definitely stronger than over-the-counter options, and these may work well on tiny small size warts and warts on your hands, but unfortunately not so much on the foot. Cryotherapy is quite painful during the treatment and during the treatment recovery, and typically requires 3 to 4 visits to get rid of these warts. And it may not penetrate deep enough to fully resolve the wart, and also could cause the damaging to the surrounding healthy tissue. Now, cantharidin is another treatment option that involves use of compound medication. This medication is applied to the wart and causes a painful blister that puts pressure on your warts blood vessel and shutting them down. This treatment must be repeated every 2 to 3 weeks until the wart is completely gone. Though it is effective, it is the most painful option with potential prolonged downtime and could cause severe damage to the surrounding tissue. In my opinion, this is the best of the conventional solutions that works, but they still have a drawback in that it's very painful. Now, one question that I get asked a lot is, why can't you just cut it out? And while surgical removal is certainly an option, it is not without its downside. If I were to remove the wart completely surgically, I would have to cut through what's called dermal layer of your skin, which this could actually cause a very bad scarring. And as we know, scar tissue can be very painful, even worse than the wart itself. Now, that's why I always suggest surgical removal as a last resort and only use it in rare cases. So we've talked about various treatment options for plantar warts, and it is clear that none of them are without their downsides. And assuming like cantharidin does its job, get rid of your wart, and you would think that that's fantastic, hey, I'm happy, but unfortunately, warts have an extremely high recurrence rate, making them incredibly frustrating for both you and I. So you may ask, then where do I go from here? How do I get rid of my warts? But don't worry, in next week's video, I'll be sharing treatment options that is highly effective with minimal pain and minimal downtime. Studies showing 1% recurrence rate. I've been successfully treating my patients with the system, and they've been happy with it. So I'll be discussing that in next video, so stay tuned.